Question 1. A nurse is caring for a patient with heart failure. Which finding indicates the patient's condition is worsening and requires immediate provider notification? A. Weight gain of 3 pounds in 2 days. B. Bilateral 1+ pitting edema in the ankles. C. Blood pressure of 118/76. D. Heart rate of 72 beats per minute. The correct answer is A. Weight gain of 3 pounds or more in 2 days is a critical sign of fluid retention in heart failure patients. This indicates worsening cardiac output and requires immediate notification. Teach patients to weigh themselves every morning before eating and after urinating. Same scale, same time, same clothes. Question 2. A nurse is reviewing an ECG strip. The rhythm is regular, rate is 88, P waves are present before each QRS, PR interval is 0.28 seconds. How does the nurse interpret this rhythm? A. Normal sinus rhythm. B. First-degree AV block. C. Second-degree AV block type 1. D. Atrial fibrillation. The correct answer is B. A PR interval greater than 0.20 seconds indicates first-degree AV block. The impulse is delayed at the AV node, but every P wave still conducts to the ventricles. It is not immediately dangerous, but requires monitoring and provider notification. Normal PR interval is 0.12 to 0.20 seconds. Question 3. A patient on a cardiac unit develops sudden onset of chest pain, diaphoresis, and shortness of breath. The 12-lead ECG shows ST elevation in leads 2, 3, and AVF. The nurse recognizes this as which type of MI? A. Anterior MI. B. Lateral MI. C. Inferior MI. D. Posterior MI. The correct answer is CST elevation in leads 2, 3, and AVF indicates an inferior wall myocardial infarction supplied by the right coronary artery. Inferior MIs can cause bradycardia and hypotension due to right coronary artery involvement. Door-to-balloon time under 90 minutes is the priority. Question 4. A nurse is preparing to administer digoxin 0.125 milligrams to a patient. The patient's potassium level is 2.9 mcl. What is the nurse's priority action? A. Administer the digoxin as prescribed. B. Hold the digoxin and notify the provider immediately. C. Give the digoxin and recheck the potassium in 4 hours. D. Reduce the dose by half and monitor for toxicity. The correct answer is B. Hypokalemia dramatically increases the risk of digoxin toxicity because both compete for the same binding sites on the sodium-potassium ATPase pump. A potassium of 2.9 is critically low. Hold the digoxin, notify the provider, and anticipate potassium replacement. Never give digoxin when potassium is below 3.5. Question 5. Which finding should the nurse report immediately for a patient who is 2 hours post-cardiac catheterization via the right femoral approach? A. Blood pressure 136/84. B. Complaints of needing to void. C. A hematoma forming at the right groin insertion site. D. Heart rate of 78 beats per minute. The correct answer is C. A hematoma at the femoral insertion site after cardiac catheterization indicates arterial bleeding and requires immediate pressure and provider notification. Post-cath nursing priorities include: assess insertion site every 15 minutes, keep extremities straight, check distal pulses, monitor for retroperitoneal bleeding signs including flank pain and hypotension. Question 6. A nurse is caring for a patient with a chest tube connected to a water seal drainage system. The nurse notes continuous bubbling in the water seal chamber at rest. This finding indicates A. Normal titling with respirations. B. An air leak requiring immediate assessment. C. Adequate lung re-expansion. D. The suction level is set too high. The correct answer is B. Continuous bubbling in the water seal chamber at rest indicates an air leak in the system or from the patient's lung. Titling, water rising with inhalation and falling with exhalation, is normal. Assess all connections from the insertion site to the drainage unit. Notify the provider if the source cannot be identified. Question 7. A patient with COPD is admitted with an exacerbation. Arterial blood gases show pH 7.32, PACO 258, HCO 326. The nurse correctly identifies this as A. Metabolic acidosis uncompensated. B. Respiratory acidosis with partial compensation. C. Respiratory alkalosis compensated. D. Metabolic alkalosis uncompensated. The correct answer is B. pH below 7.35 means acidosis. PACO 2 above 45 means the lungs are causing it. Respiratory acidosis. The bicarbonate is mildly elevated at 26, meaning the kidneys are starting to retain bicarb to compensate, but the pH is still abnormal, so this is partially compensated respiratory acidosis, common in COPD exacerbations. Question 8. A nurse is suctioning a patient through an endotracheal tube. Which action by the nurse requires intervention? A. Hyperoxygenating the patient before suctioning. B. Applying suction for no more than 10 to 15 seconds. C. Suctioning every hour on a scheduled basis. D. Assessing breath sounds before and after the procedure. The correct answer is C. Suctioning should only be performed when clinically indicated, not on a scheduled routine basis. Indicators include audible secretions, increased peak airway pressures, visible secretions, or decreased oxygen saturation. Routine suctioning causes unnecessary mucosal trauma, bleeding, bronchospasm, and hypoxia. Question 9. A patient develops sudden onset of dyspnea, tracheal deviation to the left, absent breath sounds on the right, and hypotension. The nurse suspects A. Right-sided pleural effusion. B. Right-sided tension pneumothorax. C. Left-sided spontaneous pneumothorax. D. Pulmonary embolism. The correct answer is B. Absent breath sounds, tracheal deviation. Away from the affected side, hypotension and sudden dyspnea are the classic signs of tension pneumothorax, a life-threatening emergency. Air is trapped in the pleural space, compressing the heart and great vessels. Immediate needle decompression at the second intercostal space midclavicular line is required. Question 10. A nurse is caring for a patient on mechanical ventilation. The low-pressure alarm activates. The nurse's first action is to A. Increase the tidal volume setting. B. Assess the patient and check for a circuit disconnection. C. Suction the airway for secretion buildup. D. Administer a bronchodilator treatment. The correct answer is B. A low-pressure alarm means the ventilator cannot build pressure. The most common cause is a circuit disconnection or leak. Assess the patient first for signs of distress. Then systematically check all ventilator connections from the patient to the machine. High-pressure alarms indicate obstruction such as secretions, biting the tube, or bronchospasm. Question 11. A patient is prescribed warfarin for atrial fibrillation. The INR result is 4.8. The patient is not actively bleeding. What is the nurse's priority action? A. Administer the next warfarin dose as scheduled. B. Hold the warfarin and notify the provider. C. Administer vitamin K 10 milligrams IV immediately. D. Give fresh frozen plasma to reverse the anticoagulation. The correct answer is B. An INR of 4.8 is supertherapeutic. The therapeutic range for atrial fibrillation is 2.0 to 3.0. The nurse must hold the warfarin and notify the provider. Vitamin K and FFP are used for active bleeding or emergency reversal, not for elevated INR alone. Monitor closely for signs of bleeding, including hematuria, melena, and unusual bruising. Question 12. A nurse is teaching a patient about taking oral iron supplements. Which instruction should be included in the teaching? A. Take with milk to coat the stomach and prevent nausea. B. Take with orange juice to enhance iron absorption. C. Take with calcium supplements to improve bone health. D. Take with antacids to reduce GI side effects. The correct answer is B, vitamin C, found in orange juice. Converts ferric iron to ferrous iron, which is more readily absorbed in the GI tract. Milk, calcium, and antacids all inhibit iron absorption. Also teach, take on an empty stomach if tolerated. Stools will appear dark or black, which is expected and not blood, and avoid taking within 2 hours of other medications. Question 13. A patient receiving IV vancomycin develops facial flushing, erythema of the neck and chest, and hypotension during the infusion. The nurse recognizes this as A, an anaphylactic allergic reaction requiring epinephrine, B, red man syndrome caused by too rapid infusion, C, a normal expected side effect requiring no intervention, D, vancomycin-induced nephrotoxicity. The correct answer is B. Red man syndrome is a non-allergic infusion reaction caused by too rapid vancomycin infusion. It causes flushing, erythema, and hypotension from histamine release. Slow the infusion rate to infuse over at least 60 minutes and notify the provider. Diphenhydramine may be administered. This is not a true allergy. The patient can still receive vancomycin at a slower rate. Question 14. A patient is taking lithium for bipolar disorder. Which early sign of lithium toxicity should the nurse teach the patient to report immediately? A, mild hand tremors and polyuria. B, coarse tremors, confusion, and muscle twitching. C, seizures and cardiac dysrhythmias. D, respiratory depression and coma. The correct answer is A. Early signs of lithium toxicity include fine hand tremors, nausea, diarrhea, and polyuria. These occur at levels above 1.5 MEQL. Moderate toxicity at levels 1.5 to 2.5 causes coarse tremors and confusion. Severe toxicity above 2.5 causes seizures and dysrhythmias. Therapeutic range is 0.6 to 1.2 MEQL for maintenance. Adequate hydration and consistent sodium intake are critical to prevent toxicity. Question 15. A nurse is preparing to administer metformin to a patient scheduled for a CT scan with contrast dye today. What should the nurse do? A, administer the metformin as scheduled. B, hold the metformin and notify the provider and radiology. C, give the metformin after the scan is completed. D, reduce the metformin dose by half for the day of the scan. The correct answer is B. Metformin must be held before contrast dye administration and for 48 hours after, because contrast media can cause acute kidney injury, which then leads to metformin accumulation and life-threatening lactic acidosis. Hold the metformin, notify the provider and the radiology department, and ensure renal function is reassessed before restarting it after the scan. Question 16. A nurse is triaging 4 patients in the emergency department. Which patient should be assessed first? A, a 45-year-old with a blood glucose of 320 mg/dL reporting increased thirst. B, a 68-year-old with chest pain radiating to the left arm and diaphoresis. C, a 30-year-old with an ankle sprain reporting pain of 7 out of 10. D, a 55-year-old with a UTI reporting burning on urination and low-grade fever. The correct answer is B. Chest pain radiating to the left arm with diaphoresis is a classic presentation of acute myocardial infarction, a life-threatening circulation emergency. This patient goes first. ABCs and Maslow guide all prioritization. Circulation threats beat metabolic issues, pain, and infection unless the infection is causing sepsis. The diabetic and UTI patients are concerning but stable and can wait. Question 17. A nurse receives a phone order from a physician for morphine, 4 milligrams IV push for a postoperative patient. What is the correct nursing action? A, administer the medication immediately as ordered. B, write down the order, read it back to the physician, and receive confirmation. C, ask a second nurse to witness the verbal order before giving it. D, refuse the verbal order and request a written order before administering. The correct answer is B. Safe verbal order protocol requires write it down completely, Read it back verbatim to the prescriber. Receive confirmation that the order is correct. WRRR. This is especially critical for high alert medications like opioids. The order must be co-signed by the provider within the facility's required time frame, typically 24 hours. Document the time, date, and provider name. Question 18. A nurse discovers that a patient received the wrong dose of insulin 1 hour ago. The patient is currently asymptomatic with a blood glucose of 118 mg/dL. What is the nurse's first action? A. Complete an incident report before doing anything else. B. Assess the patient, notify the provider, and monitor blood glucose closely. C. Call the pharmacy to determine what the correct dose should have been. D. Document the error in the chart and continue monitoring. The correct answer is B. When a medication error is discovered, patient safety is always the first priority. Assess the patient's current condition, vital signs, and glucose. Notify the provider with the full details. What was given, what should have been given, the time, and the patient's current status. An incident report is completed after the patient is stable. It is an administrative action, never a first response.